Hello, my name is Roy Murphy. I'm sorry to hear that you're having sciatica or pain down your leg. For sciatica, after we've tried conservative treatment, medications, injections, physical therapy, and if the pain persists for more than 4 months, we'll often consider surgery. The good news is surgery can be very effective at improving pain down the leg and numbness and tingling, and recovery is generally very good. For a discectomy, we'll often use either a small tube through a 16 or 18 millimeter incision, and this leaves a very small scar. In some situations, we'll use small cameras called endoscopes to go in and carefully find the disc fragment that's compressed in the nerve. Generally, the surgery involves coming in. The operation takes approximately 45 minutes to an hour, with half an hour setup time, getting you into the operating room, get the anesthesiologist carefully putting you to sleep, position you to lying face down, doing x-rays to confirm our site and our target, and then cleaning and prepping the back. From cutting the skin to closing the skin, that takes approximately 45 minutes to an hour. Afterwards, generally people recover in the recovery room for an hour or two, and the vast majority of people will go home the same day. Discectomy, either through a tubular discectomy with a microscope or an endoscopic microdiscectomy, both have very good success rates. In general, with the New England Journal of Medicine 4 versus 12 months sciatica study, they showed that if somebody had pain of approximately 8 out of 10 going down their leg, that we could generally get the pain down to a 2 out of 10. Now that pain in some people can go away very quickly after surgery, in the first few hours or days after surgery. In some people, it can take a month for it to slowly go away. Numbness and tingling can be unpredictable. Generally, sharp pain improves the quickest, and then numbness and tingling go away slowly. In what situations would you consider a discectomy, either through a tube or an endoscope? If you've had pain going down your leg that's severe and lasted more than 4 months despite trying medications and injections and physical therapy, generally a discectomy can improve your quality of life and has a good chance of improving the pain. Another serious indicator to you may need surgery includes weakness in the leg. If you can't pull your foot up off the floor, you develop a foot drop. And another very serious symptom includes an inability to pee or losing your sensation in your private parts. This syndrome is called cauda equina. This is a surgical emergency. Thankfully, it's not that common, but it requires immediate surgery. And this means that you have surgery, you would not wait 4 months, you go straight to surgery. Generally, after surgery, most people, the vast majority of people, go home the same day. Oral medications, including Tylenol and ibuprofen, can control most people's pain post-operatively. The incisions are small, and we use special medications, including special local anesthetic, to reduce the pain. Sometimes you may need a very short course of low-dose opiates for a day or two afterwards. For the first 6 weeks, you need to take it easy after surgery. You won't damage yourself or cause problems with normal activities. And these include making a cup of coffee, making your food, gentle activities around the home, dressing yourself. But you do need to be careful when you're bending or twisting. Simple, gentle bending and twisting will not cause an injury, but lifting heavy objects and bending and twisting may cause problems. One risk of heavy lifting after surgery includes a discectomy a recurrent disc herniation. So the disc may herniate out again, causing pressure on the nerve. Thankfully, this is rare. After 6 weeks of recovery and the tissues have calmed down and the wound is healed nicely, we generally start physical therapy to build you up again, strengthen your muscles, and they'll reduce the chance of another disc herniation occurring. After a microdiscectomy, most people will have steri strips on their skin, and then I'll put a waterproof dressing over the wound. This waterproof dressing, you can shower with it on, and generally take the waterproof dressing off after 4 to 5 days. The steri strips will slowly start to peel off after 7 days. If they are still there after 7 days, you can dab the wound and gently peel off the steri strips. I will normally see you approximately 2 to 3 weeks after surgery, 6 weeks, and then depending on how you're doing, we'll decide if we need to see each other afterwards. After surgery, you can't use hot tubs. Do not submerge the incision in a bath, and don't go swimming. We generally wait at least 4 to 6 weeks before swimming. You may shower. You may get the wound lightly wet, because after 48 hours, the wound has a thin waterproof layer, but you can't soak it or submerge it, as this could cause it to swell up or maybe open. Now, a microdiscectomy is a very effective, successful surgery, and it can really help people, but there are risks. What are the risks of a microdiscectomy or a endoscopic or tubular discectomy? Risks include a small risk of infection, a 1 or 2% risk of infection, wound healing issues, which are rare. There's a risk of a spinal fluid leak, which is generally 1%. A spinal fluid leak can be a mild problem or a severe problem. A mild problem can be fixed during the surgery, maybe a small little hole in the dura that can be either fixed with a suture or with glue. A more severe leak may require staying after the surgery, lying flat, and maybe, rarely, further operations to fix it. A famous example of a person who had a spinal fluid leak includes Steve Kerr, the Golden State Warriors coach. Other risks include nerve injury, weakness, and very rare risks including damage to arteries and veins, general anesthesia risk, stroke, coma, paralysis, and even possible death. But thankfully, those are extremely rare. Thank you.